Hey, Mike Sevilla here from FamilyMedicineRocks.com, coming to you again from the conference on practice improvement. And I have Dr. Bruce Bagley here talking with us today, and had a great session yesterday about practice transformation. And thank you so much for the time. And what I wanted to talk about in our brief interview was risk stratified case management. For those of people who don't know about it, can you explain a little bit about it and why it's important?
Well, Mike, thanks for that. And we're trying to promote risk stratified care management. And everybody knows that there's a certain group of people in their practice, patients that need extra help navigating the system or getting what they need when they need it. Certainly there's a lot that don't need that, but trying to figure out who's who is the hard part. So we've developed a very simple tool, or at least simple to understand tool, to help categorize people into 5 risk groups, so that you can then develop systems in your practice to take care of the ones that need extra help, especially the ones that are 4 and 5, the higher categories. So it just went online Wednesday, 2 days ago, and you're going to put on the URL so everybody can find it. But it's a neat little tool to help you organize your work around risk stratified care management. The next thing I wanted to point out that we talked about yesterday is the importance of having a registry that keeps track of all those people in the categories that you're working with. So especially 4 and 5, where they need extra help. You need to know what their problems are, how frequently they get contacted, when they were in the ER last, all that stuff. But you have to have a way to organize that so it's useful. And the final thing I'll say is that this needs to become part of the care team's responsibility. So using the registry helps them all understand who needs extra help and who does not, and it becomes a care team's responsibility to contribute to that registry to make sure all the information's in it so it can be used well.
Great. Well, one final question is, you've been talking with family docs a long time about practice transformation and things. Can you share a little bit about the response and the feedback you've been getting from membership?
What if the people listen to us, they recognize that what we're trying to help them do is do the work they're doing already, but more efficiently. And using a registry organizes the work and, for instance, organizes the work, presents it in a way that's more useful and more efficient for them to do their visit or their phone call or anything else they're trying to do with patients. So I really do think we're coming along. This may be an aside, but in the most recent board exam that was done this year, there was a question on there, how many are using electronic medical records or not. 81% of the respondents who took the exam this year said they're using electronic medical records. So I think we're past the tipping point. We've got general acceptance that we need information technology support to help us do a good job. So that's really exciting.